Hello, everyone. Welcome to the Model Law Knowledge Lab on harm reduction and overdose prevention. I am Becky Rose, a senior director here at Rulo Strategies, and I am part of the team that's supporting the Legislative Analysis and Public Policy Association, otherwise known as LAPA, to bring you this Knowledge Lab today. I am joined by my colleague, Tara Kunkel, who you will see interacting in the Q&A. What are these Knowledge Labs exactly? These are virtual learning series that provide stakeholders with an opportunity to deepen their awareness and understanding of how model laws can assist jurisdictions in addressing substance use disorders. These Knowledge Labs are made possible by a grant from the White House Office of National Drug Control Policy. And I'd like to offer a special welcome to staff from ONDCP here with us today, and thank you all for your support. In addition, we are joined by representatives from LAPA who have led this project on behalf of ONDCP. A very special welcome to Sarah Kelsey, Susan Weinstein, and John Woodruff. The LAPA team will be engaging in the chat, answering questions, and sharing relevant resources. Just a little housekeeping before we get started. All attendees are muted, but we can interact with you through the Q&A box in your Zoom control panel. During the discussion today, we will hear from experts on harm reduction and overdose prevention efforts. We encourage you to ask questions in the Q&A box as the discussion is ongoing, and we will get to them at the end of the conversation. We will also be posting relevant resources in the chat box throughout the discussion today. This session will be recorded and will be made available on the Knowledge Labs tab on LAPA's website in a few short days. Now I'd like to introduce our expert moderator today, Melissa Larson. Melissa is a public health analyst with RTI International. She has a wealth of experience in the discussion area today from her role at RTI, but also from the state of North Carolina. We are so excited to have her here today to lead our discussion. Melissa, welcome.
Thank you. I'm so glad to be here, and I welcome everyone to our discussion today. We will be covering a really important topic, and our objectives for today's discussion is to learn from the experts with respect to their efforts in harm reduction and overdose prevention, learn why it's important to address this issue, and share ideas on varying approaches to initiating this work within states. And as Tara mentioned, I do come from this great state of North Carolina, and I was really fortunate to work with a law enforcement agency for about 16 years and then work at North Carolina Harm Reduction for about 6 years. So kind of bringing all that experience together, and it's just so great to see the evolution of the legislation and just the initiatives that are really happening in the communities to impact the public health of our citizens. So excited to be here, and I would love to introduce our expert panel who's joining us today. Dr. Drew Parkin is an assistant professor of medicine and epidemiology at Brown University, as well as a research scientist at Rhode Island Hospital. Dr. Park has extensive experience in conducting a wide variety of studies and has published over 80 peer-reviewed publications on substance use, HIV, and overdose. Ms. Anna Stein joins us from the Chronic Disease and Injury section of the North Carolina Division of Public Health. She's a policy advisor in the areas of drug overdose prevention, harm reduction, medications to treat opioid use disorder, tobacco control, alcohol, and cannabis, among other areas. She obtained her law degree and master's in public health from the University of North Carolina at Chapel Hill. And then Captain Jason Piotrowski, he oversees the Office of Drug Monitoring and Analysis in the New Jersey State Police. In this position, he oversees the collection, analysis, information sharing, and training and outreach efforts related to the drug environment, specifically focused on the overdose epidemic. Captain is also a Bloomberg American Health Initiative Fellow and Master of Public Health candidate at Johns Hopkins University, focusing on overdose, addiction, and health disparities. So wonderful panel today, really excited about this. Well, to get us started today, Dr. Park, we have our first question for you. And you were involved in helping author LAPA's model law on fentanyl test strips and other drug checking equipment. Why do you think the model law was needed?
Yeah, well, before I answer that question, I just want to make sure that everyone is on the same page about what we mean by drug checking here. And so, because there may be some folks who are less familiar with these programs, drug checking refers to community-based programs where people can voluntarily submit drug samples for testing to understand what exactly is in their local drug supply. So we're not talking about self-testing kits like those urine cups you see at pharmacies. We're not talking about the urine tests done at doctor's offices, hospitals, labs, or police departments typically. Um, we are talking about the collection of voluntary drug samples. And the reason why this is important is because these drugs that are purchased from the unregulated drug market tend to be very unpredictable and contaminated with dangerous chemicals. So you may have heard about xylazine, which is a very potent veterinary tranquilizer that is appearing in fentanyl samples. You may not have heard about levamisole, but it is definitely present in the cocaine supply. The deworming agent attacks the immune system. And even substances like carfentanil, which is the most deadly synthetic opioid that we know of. So when we think about fentanyl test strips and drug checking programs that can detect things other than fentanyl, we want to, consider what is the legal landscape and the policies that need to be kind of addressed. So because of existing drug paraphernalia laws, many states actually consider drug checking tools like fentanyl test strips as paraphernalia that can be cause for an arrest. And some people can even be charged with a felony for having these on them. So that's problem number one. These tools are being categorized as paraphernalia, like sterile syringes, fentanyl test strips, and it's very varied by state. So you have to look at your state's laws. So that's problem number one. Problem number two is that these supplies, in addition to these supplies, the other equipment that is required to assemble, package, transport these substances in order to test them, those might be illegal. And so that can look like Ziploc bags, cookers, spoons, syringes, if they were used and submitted for drug checking. And some of these supplies are just things that you would buy at your local pharmacy. So problem number two. Problem number three, and I know this is long-winded, but it is a fairly complex issue. So this is why we need to understand that, of course, carrying small amounts of drugs is illegal in every state except Oregon. So people who use drugs, people who are addicted, they're ending up behind bars or dying behind closed doors because of the stigma and fear. So this is the way to treat this issue as a public health issue.
Mm-hmm. Thank you so much for setting the stage and really talking about some of the barriers that these laws are able to help us overcome. Captain, you were also involved in helping author the model law on fentanyl test strips and other drug checking equipment, as well as other LAPA model laws. Do you have any experiences or thoughts from a law enforcement perspective on why this is needed?
Certainly, yes. From my experience working with, in my job with the state police, working with a lot of diverse partners has really informed me and certainly changed my perspective on harm reduction and some of the best ways to help people with substance use disorder. It's been an evolution over many years in my case, but this process was really kind of a microcosm of that. And learning and understanding others' perspectives was really important, was really paramount. And as well as being able to share the perspective of law enforcement, I think that's all important so we can all be better informed and make better decisions.
Mm-hmm. Absolutely. Anna, you were involved or actually authored the North Carolina law on drug checking equipment. And we all know that there's a long history of working with law enforcement in North Carolina that you've been able to do on harm reduction efforts. Is there anything that you want to add from your experiences working directly with law enforcement?
Well, are we going to get into the process of them creating the model law? I don't want to jump ahead and into my processes for writing the law. I'm trying to figure out where we are right now.
Tara or Becky, do you have a perspective on that?
Anna, you can go ahead and chat a little bit about that. Go for it.
Okay. Well, so we didn't have the model law back in 2019 when we were working on our fentanyl test strip law. That's when ours was passed. And I'll just say, so I'm the person that you write these model laws for, because I'm the person that's on the ground in the state who uses tools like this. And I will say that the more resources that we can have to help us when we are starting to craft state laws, the better. So it's great to have more resources. I will say what I tend to do when I'm starting to write, and typically you're amending a current statute is what you're doing, rather than starting from scratch and writing your own law. So typically you've got a paraphernalia law in place in your state, and you're trying to figure out how to edit it to suit your needs. So what I do is I look at all the other states that have passed, who had done at that point drug checking laws, which at that point was maybe around, gosh, it wasn't that many states, like maybe 5, or I can't remember, but it wasn't a ton of states that had started this type of work. So it's really good to look at actual state laws. So not just a model law, because those are like kind of this perfect ideal, and they tend to be like way longer than an actual statute is going to be that you're going to pass in your state. And so it is important to look at actual laws on the books in other states. And it's also important politically, because for me, when I take a statute to legislators, or my legislative liaison does it more accurately, they want to know what other states have done it, and like where we're getting our language from. And they want to know that it is a state that they respect, and that they align with politically. And so they don't want to hear that I'm looking at what Massachusetts has done or California has done, or they are really going to be picky about what states. And I can actually shoot myself in the foot if I, say, well, look at this great new law out of Oregon. That's not going to go over well in my state. So you just have to be very cognizant of the political considerations in your state when looking at what other states to model yourself off of. So, and I would say that you're also going to be having to look at the language, kind of the conventions of your state statutes. Like some states don't define a lot of words. Like the model law has a lot of definitions in it. They're like defining everything. So some states do that, some states don't. So I would say that it is really important to use the model law as an educational tool to educate you about possibilities. And the commentary is really great to give a background for the issue. But at that point, you really need to look at states that have passed it and states that are going to be persuasive to your own legislators. And then again, just the conventions of your state. Like, do you tend to in state statutes, do you do all the whereas statements? My state does not. And so again, you're really trying to tailor it to the way your state does it. So it's a jumping off point. And in terms of working with law enforcement, your question, Melissa. So in North Carolina, when it comes to passing harm reduction legislation, working with law enforcement is key, because our legislature will not pass harm reduction legislation that law enforcement has not, that they're opposing. Now, we can't typically get law enforcement to actively support our harm reduction legislation. They're not going to be advocating for it. What we ask is that they don't oppose it. And that's typically, that's enough for legislators. If we can say that this group doesn't oppose what we're trying to do, that's a win. And so we do have to communicate with law enforcement groups whenever we're trying to advocate for harm reduction changes. And so, for example, I definitely convened a group of law enforcement and ran the test strip language by them back in 2019 and got them on board. And that was really critical when we went to legislators to get the legislation actually passed. And I will stop talking.
Thank you so much, Anna. And so really that legal
Yeah.
landscape, really assessing what you think legislation would approve. And then using the model law as a jumping point for that is what I heard. And also the advice to other areas about talking to your law enforcement agencies to run the language by them. Yeah, kind of testing the climate and the temperature there. Any brief thoughts on how that maybe worked with the North Carolina Syringe Service Program law, engaging law enforcement there prior to passage?
Yeah. So I wasn't involved in that work. The state really didn't do that. It was the North Carolina Harm Reduction Coalition, but they had spent years working with law enforcement in our state, trying to build a rapport. And they did that by training law enforcement on how to avoid needle sticks. And it was only by developing that relationship with law enforcement that our then executive director of the Harm Reduction Coalition, Robert Childs, and other people working with the Harm Reduction Coalition were able to broach that conversation about syringe exchange and the importance of it. And it was really years in the making. And our law passed on the last day of the session in 2016. So yeah, that relationship with law enforcement was absolutely critical to get that law passed.
Great. Thank you for sharing those experiences. Dr. Park, are there any additional issues or considerations that you would suggest related to implementing drug checking laws?
Yes, there are a number of issues. One is people may be wondering why we are not just focusing on fentanyl test strips when fentanyl is the number one, drug involved in overdoses, and why we're talking about drug checking more broadly. And the reason is because the drug supply is always changing. There are new substances, synthetic drugs, not just opioids, coming onto the market every year. And so to be really responsive to the changing drug market and to really know what is going on in real time, these more comprehensive programs are needed. So it's related to the question in the chat, which is about xylazine test strips, which are currently being researched and evaluated. Actually, I'm also involved in some of that work here in Rhode Island. We really need to be looking at comprehensive models. So the FTIR, you may have heard of spectroscopy is one option, mass spectrometry or LCMS. There are many instruments being used, and many of them have been validated for this purpose. And they are great because they're very adaptable. You can really just add to the existing library, is what they're called, to add novel substances as they come up. But additional other considerations, I would say protecting the confidentiality of clients and patients. It's something that doesn't come up as much, I think, in the drug checking space as I would like to see. Then there's an entire section in the LAPA model law that you can reference that can guide your state to make sure that the information that's being collected is going to be kept secure. Because when I do my research and talk to people who use drugs, talk to people affected by drug policy, one of the first things people say, or people are afraid of, what's going to happen to my information? Like, what are you going to do with this? And it's because people have had the experience, unfortunately, of having their, rights violated, or, information being given away, and resulting in incarceration, et cetera, et cetera. So trying to do everything that you can, whether it's legally, policy-wise, or programmatically, to make sure that people's confidentiality is protected, I think is really, really important.
Mhm. Those are great points. So keeping in mind confidentiality of those using the drug checking equipment services, and also keeping your language broad so that the law that you create will transcend over time as everything changes. Thank you so much for that. Captain, anything you would like to add?
Dr. Park did a great job there covering some of the things I would echo. You might not have the perfect solution at any given point of time, so you want to be able to ultimately you want to create laws that won't be ineffective or antiquated in the short term, and won't be restrictive as the trends change, because we are going to see, and we continue to see, new drugs, and we're going to continue to see more mixed into the supply. And one of the trends we are seeing is a lot more stimulants being adulterated with synthetic opioids, which exposes people to a high risk scenario if they're opioid naive. So we have to really, again, keep sharing that forensic lab data, the toxicology data, to ensure the equipment is up to date and it's effective to provide the most benefit and the most harm reduction.
Yeah, great points. Thank you so much, Captain. So we've talked a little bit about your partnerships with law enforcement and how important that is. So let's kind of now talk about harm reduction agencies in your community and how they can be supportive, or other public health agencies. So Anna, in your state of North Carolina, you work closely with harm reduction agencies on implementation issues. Are there any particular insights from the field that you can share with other states?
Yeah, so we have a monthly meeting of people who work in the field. Many of the people are people that actually run syringe service programs, and that's been very important to help guide our implementation of these programs, because while we don't have a formal oversight role, we are required to register syringe service programs, and they have to report data back to us. So it's very important for us to create a low burden implementation. We public health people, our tendency would be data. Like, we just want all the information we can get. And we really have to talk with people who are working in the field about what is feasible for them, what information is feasible for them to give us, what we absolutely have to have in terms of what the statute says, and what we would like to have and what they're able to give. And we can also work with them on like data collection, gathering tools, create tools for them to make it easier. So there's just a lot of conversations from that perspective in terms of just oversight of the program, but also trying to get information about problems that they're seeing in the field, whether that's community, community members who are maybe concerned about having a syringe service program in their area, and then trying to brainstorm of ways to, have better relations with the community, or if law enforcement in the area don't seem to know about our syringe services law, which is actually a lot more common than we would like. And so actually, right before I got on this presentation, I was writing an article for a newsletter of our conference of DAs to try to, talk about the syringe law and how important it is for them to try to educate local law enforcement. So we're at the Division of Public Health constantly thinking about ways to get out the news about the law. Because with 100 counties and 11 million people and, you know, new law enforcement constantly coming in and so many laws that they have to learn, it's easy to understand how this, this might be something that, that they don't learn. So we're trying to help do our part to educate.
Thank you, Anna. So data collection for sustainability, that is always critical, right? So that's a great suggestion. And you're right about the training of law enforcement. There are a lot of demands on law enforcement. And so as these laws are enacted, you want to make sure that when they're out there working in the field, that they're aware of it. So that is excellent. Captain, I love this next question, and it is for you. Do you have any advice or suggestions for groups looking to work effectively with law enforcement as allies in the legislative process when they're wanting to introduce harm reduction legislation in their state?
Yeah, again, I'm going to double down again on one of my panels here, what Anna said about education. I think for me, I think it starts with understanding substance use disorder and the many factors that can lead to addiction and overdose. And so education and communication become paramount. The first thing you want to do is essentially, which may be problematic in this setting, is to reduce the stigma and understand that, you know, anyone can be and may have been affected by the overdose crisis. And the facts are in our favor in this, as far as that goes. So I think if you can push that information out and the education and awareness to law enforcement so that they understand how important it is to engage in maybe a different way than they previously have, I think that's really important. I think you can get people on the same page. And once everyone is on the same page, we can start working together on solutions and help and protect people. And harm reduction is certainly a tool that we need right now. Absolutely.
Mm-hmm. Do you have any insight, Captain, on, let's say I was an ally who was really wanting to promote this in my state, but I wanted to talk to law enforcement. Any suggestions on best practices in engaging with law enforcement, especially if I'm not used to it?
So I talk with a lot of people all over the country, and this was brought up before by Anna as well. It really depends where you are and how you're going to start that conversation, because those in certain states people are more open and progressive, in other states they're not, and I've fallen into that trap myself, to be honest with you. But so it really depends. But the strategies, I would just say again, stick to being evidence-based and data-based, and there's a lot of strategies that I employ when I talk about this. I talk a lot about the factors that lead to SUD, like ACEs or PTSD from the military or other traumas, and what I would say is law enforcement, they can get behind that. They can get behind trauma to children. They can get behind certainly our military. There's a strong relationship there, and so for me, those have been effective strategies across the board.
Yeah, that's great. So starting the conversation and bringing the evidence with you. I've had many chiefs or sheriffs ask me so does it work? Where's your data? So great advice. Dr. Park, question for you. What are your thoughts on how drug checking can be used by states or researchers to inform public health surveillance?
Thank you for that question. I think that what we have to realize is a lot of the people who are doing this work in the community on the ground are kind of operating in a black box. Like, a lot of us don't know what is, present in the local drug supply on a day-to-day basis. And so because these programs can give that information in real time directly to the community that's affected, it's really different to the kinds of information you get from, for example, clinical settings or postmortem, data on overdose deaths a year later, in some states 2 years later. So this is about building a robust public health response and reduce not just the negative outcome, fatal overdose, the worst outcome, but other negative outcomes as well. I mentioned xylazine. It is associated with really nasty wounds and hospitalizations, ED visits, things like that. And we think that this information really can complement existing public health surveillance systems. And there are a number of really good examples that have come out. The ones that come to mind, the Maryland program, it's called the RAD program. There was a CDC report that just was released, and I'm happy to share that if anyone is interested. So that gives an example of a large statewide drug surveillance program that really harnesses this idea of drug checking. Another one, there's an entire network of drug checking programs across Massachusetts right now called MEDS. And so those are just two simple examples. Oh, and actually North Carolina has an excellent partnership between a local harm reduction organization led by peers and the University of North Carolina. So a partnership between academic researchers and community organizations. So these are just three examples of how these systems can be built. And the idea really, again, is to get that information to the community as quickly as possible to prevent negative outcomes associated with drug use.
And you had some resources to share with the attendees today. I'm not sure if they've maybe already. Oh, look, Tara and I are reading each other's minds. So one on implementing community drug checking and the other directory of drug checking programs. Tara, is that what I think? Would you maybe just put in the chat?
I sure did. Yes.
Thank
Working
you.
on it now.
Great.
Yeah.
So last question for our panelists, for each of you, and Captain, I'll let you go first. Some of our attendees may be from states that are less far along in advancing harm reduction policies as compared to other states. Can you give the individuals in those states one or two key areas where you believe changing laws are most important? And it could be laws related to SSP, could be laws related to other drug checking equipment or fentanyl test strips.
Yeah, certainly the one I would focus on is the drug checking. That's really where I would focus. The supply out there is more and more every year we see more and more different substances, whether it's nitazines, whether it's xylazine. There's several replacements all teed up for xylazine if it gets scheduled, right? And those are more potent than xylazine. And they're out there, they're available. So you kind of have to anticipate these changes, but having a safe supply is paramount right now, and understanding what you're being exposed to. That's the one place where I would really focus right now for harm reduction, and it's really what I know better than anything else. So I'm not going to delve into other areas.
No, that's great. Thank you so much. Anna?
Can you repeat the question?
Yeah, absolutely. I see you're helping in the chat. Thank you so much. For those states that are not as far along in harm reduction policies compared to other states, what would be one or two key areas that you believe they should focus on, reference changing their laws?
I would make sure that their naloxone laws are in really good shape and that they have good ability to distribute naloxone. And yeah, I'm hoping that the test strip, I feel like lots of these areas can seem very intimidating when only a few states have done it. I feel like there is so much drug checking happening now. And I mean, I think North Carolina is a great state to point to. I don't think any other state is gonna well, I could be wrong. I don't know that they would accuse us of being a liberal state. And so I think we're a nice, we do have this very robust, first of all, we have test strip distribution happening, but also the very robust drug checking that Dr. Park referenced happening out of UNC. So I'm hoping that this is going to be normalized and that even states that haven't thus far delved into drug checking, that they would have good luck if they wanted to introduce a drug checking statute. I know that in my experience, when I talked with law enforcement about drug checking, they were very on board with the idea of people who use drugs knowing what is in them. That was not at all controversial to them. And they, in fact, wanted that. If they were going to use drugs, they really wanted them to know what was in the drug. So hopefully that will be not controversial in people's state if they want to pass that. And then some other, there are many other areas of harm reduction law that we could delve into here. We're trying to improve our Good Samaritan statute here in North Carolina to include arrest, because most states do include a protection for arrest in their Good Samaritan law, and ours does not. And so that's a big source of advocacy here right now in our state.
Mm-hmm. Yeah, thank you, Anna. Dr. Park?
Yeah, just to add to what Anna mentioned, Good Samaritan laws are very important. And I think there's the law side of things and the actual implementation of those laws. I actually just spoke to a colleague who in a southern state who was arrested because he overdosed in a public location. His friend, panicked. And I think someone passing by called 911. And in addition to the ambulance arriving, police were there, and he actually ended up spending the night in jail. So it's, these laws definitely affect the lives of the people that we are trying to reach. I think syringe exchange programs are just like the cornerstone of a lot of services, not just drug checking, but naloxone programs, any sort of preventative, HIV, hepatitis C testing, wound care. There are many services that syringe exchange programs can offer. And so supporting those locally, either through legislation or funding, I think is a really important avenue. And I think the drug paraphernalia laws that I mentioned, it just like feels as somebody who is not in government, it feels like a waste of resources and a missed opportunity to me for the health department to be giving out sterile syringes and then law enforcement just confiscating those syringes. That to me just doesn't make any sense. And so we probably should not just address the drug checking, paraphernalia being confiscated, which also does happen, but all of the other tools that people are using, mostly just to, prevent themselves from getting some sort of infection, really. I think, that could go a long way to turning the tide so that we can treat substance use and addiction as a health issue.
Mm-hmm. Yeah, thank you, Dr. Park. You mentioned missed opportunities today, and I just so agree with you on that. And I think that's what's so great about the Knowledge Lab here is, being able to share this information across, states. You can learn what other states are doing and hopefully won't have those missed opportunities to really expand the services for your community. We do have a question for all of the panelists, so I will just ask the question and feel free to answer it if you like. Some states are trying to criminalize xylazine. How would you respond to these efforts?
I can jump in on this.
Jump.
So, I kind of alluded to that a little bit earlier when I talked about the replacements for xylazine. So I guess what I would say is really, really think it through. Scheduling or criminalizing xylazine. And I did a lot of work on this and put forth an opinion on this, but essentially in New Jersey, xylazine is 30 to 40% of our drug supply. Well, in the suspected opioids that are submitted to criminal forensic labs, so we're talking about, thousands of samples, maybe 10,000 a year, 30 to 40% have xylazine, but they are underrepresented in overdose deaths. And that's been a huge increase, obviously, over the last couple of years, right? So they're only about 7% of the deaths. That could be under testing and toxicology, but likely it's going to be underrepresented anyway. They're seeing similar stats like that. Fentanyl is the primary drug involved in the overdose deaths. That has not changed. There's a recent study that came out that referenced how xylazine overdoses were less severe. I have that. I could dig it up certainly, but I can't cite it exactly or off the top of my head. The other thing is that the Center for Forensic Science Research and Education, they did a piece with Vice News, and it's on YouTube. You can see it's a pretty good piece on xylazine. And the forensic scientists showed that there were 24 parts xylazine and 1 part fentanyl in the substances they were checking. He said that was pretty typical in Philadelphia. So what in the Philadelphia Department of Health also put out an open source xylazine alert, and they showed that over time, more and more xylazine, less and less fentanyl in their tested samples in Philadelphia. So with that, you're seeing a much less potent substance being put into the drug supply. Now, there are replacements for xylazine that are just as readily available that are much more potent. So you just have to really be careful with the unintended consequences with that. And I would equate it to, we went from oxycodone that, had a very, 1.5 times morphine milligram equivalency to heroin to fentanyl. Like, it just keeps getting worse. And as we've gone through this kind of overdose crisis. So again, that is something that I would really think long and hard about what the consequences could be for restricting xylazine and opening the door for kind of these other things to happen.
Thank you, Captain. And our Dr. Park.
Anna, would you like to?
I mean, I think that was a fabulous discussion of this issue, and it's so hard because I do think there's a knee-jerk reaction that any substance that is so harmful to people should be scheduled. I mean, I think I can understand the thought behind that, the conventional wisdom behind that, but I think we're in a new era now. It seems to me that we are in a new era. Maybe this is because of the internet. I was thinking about why, like, people are able to share drug formulas more easily. I don't know, but I feel like we're in an era where the drug supply changes so rapidly in a way that it didn't in past decades. And I feel like we have to adapt to that as a society and understand that just as soon as we schedule something, it will change and it will be something unscheduled and it could be more potent. And so I really do think that we need to take a pause and everyone sit around, policymakers and thought leaders. Everyone needs to sit down and think, okay, how do we react in a society where there is this ever-changing drug supply and it will immediately morph if we schedule this? What is the proper reaction to that? And I don't know what it is, right? I don't think it's not a simple answer. but I often see people not taking that into consideration, right? There's this knee jerk, like, oh, it has to be scheduled.
Mhm.
So,
Yeah.
Yeah, I'm an epidemiologist. I'm a researcher. I love facts and evidence, and I would be the first person to say yes if you know, criminalizing or scheduling a drug will reduce the supply or will make things safer for communities. I would be the first person to say yes, I support that. But the truth is,
Mhm.
substance use is a risky behavior, but we have to start thinking about it like every other risky behavior. And I also hear people say substance use is not treated like a medical condition. People with opioid use disorder are not treated as patients like you do for diabetes or heart conditions or, you know, et cetera, et cetera. So how can we approach this in a more humane way and a more evidence-driven way? And the way to do that is to look to other innovative interventions that really haven't been scaled up. If I look at the amount of funding that has gone towards the war on drugs and implementing drug control policies in this country, and contrast that to the funding that has gone to syringe exchange programs or naloxone programs or harm reduction, it's unbalanced. And so how about we, you know, turn the corner, like start a new chapter, try this at least for a decade and see where we land? Because I agree with Anna. The more we put pressure on illicit drug markets, the more potent they're going to be. And I've spoken about this many times, but, you know, I'll say it here too. Leo Beletsky, a law professor at Northeastern, has a great article called The Iron Law of Prohibition. And this theory really talks about the reasons why drug markets continue to change. And so, you know, we had prescription opioids, then those supplies were reduced, leading to heroin and fentanyl overdose. And there were some technological advances that helped, you know, the internet is one of them. But look to the research, look at the recent American Journal of Public Health paper that just came out that I believe it was in Indiana. They looked at what happens when police crack down on local opioid markets. And what happens is overdoses go up. And this was a really rigorous study that was done. It was covered by NPR and a number of news channels this month. So I guess in summary, I would say, look to the evidence, talk to your local researchers, and also we can't leave out the community. We can't leave out the harm reduction organizations that are doing this work, the perspectives of family members, of friends, of people who are directly affected. Without like a whole of society response to this very complex issue, we're really not going to make inroads. There's no silver bullet, and certainly a prohibition of xylazine is not going to solve the issue.
Mhm. Thank you, Dr. Park. Tara and Becky, are there any questions in the chat from the audience that I may have missed?
I don't have anything in chat, but I had a couple of private messages. So I was going to toss out a couple questions, if you don't mind. So, Captain, the first one is for you. You mentioned on an earlier question when someone asked about making coming to law enforcement and finding an ally in law enforcement, you mentioned bringing data. And I think that was great advice. Any other advice on kind of how to start a conversation outside of data, especially if there's not a particular relationship? How do you find that common ground? Any other particular suggestions you would offer outside of data to find common ground?
That is a tough one. It's probably going to be dependent on the the unique circumstances. So there was a recent study done by Johns Hopkins University, Dr. Cepeda, where, and I was a partnership with Baltimore Police Department, where they looked at the economics behind drug use and arrest, and really how much it costs the police department. So there's other ways to go about it, because this gets into essentially, police management and resources that you have, and then you get burnout and you get compassion fatigue and you get things like that. So those are as a benefit to the police department to not, number one, go through the trauma of going to these calls, because they are traumatic when you're there dealing with an overdose and a death and family members and things like that. That is traumatic for everybody involved, certainly, but to kind of lessen that, that may be a way to proceed, where you're talking about the benefits for the police department that you're working with, for their resources, and for their personnel as well. I think that might be another good way to approach it in some of the discussions we had. On the other side of it, what we found, and I can say this anecdotally, but when you make that change and you're more doing outreach and working more with the community, that's a whole nother benefit, especially today, where you're really engaging the community in a positive way. And that could bring tremendous benefits to the police force in a lot of different ways, and certainly the police and community relations. And so the anecdote is that, we essentially collected a lot of data, and we said, here's your most at-risk people, they've overdosed, and the police officers went out, knocked on doors, and what we were told by the people running the initiative was, at the beginning of the day, a lot of the police officers were a little pessimistic about it and kind of eye rolls and things like that. But at the end of the day, when they interacted with people who were so grateful for them showing up and trying to help them and offer support, that it really, by the end of the day, they said, this is kind of the best day I've had. This is the most help I've ever offered people. People were so grateful. This is the best day I've had in my career. And so there's a lot of benefits to the police force and police departments to engage in this overdose crisis in a different way. So that's just another way to approach it.
And your department has been hiring and partnering a lot with people with lived experience, bringing a lot of peers into your workforce. What have been some of the benefits that you've seen in bringing people with lived experience into the workplace?
So in 2019, we have the City of Angels here in New Jersey, Kevin Mira, and we hired one of his recovery coaches, and she's been kind of working on this for many years, and she's very open about this, so I'm not crossing any boundaries here, but she had some family members who had some issues, and so she was really passionate about this, and she brought her old perspective to us, and I'll be honest with you, she came to me about Trank, and years ago, before anyone knew what this was. She goes, do you know what Trank is? And some of her, so she was bringing that kind of knowledge to us, and we were kind of allowed us to kind of get ahead of it a little bit here in New Jersey. But so there were some benefits there, just on her own knowledge and her own perspective. And then now this year, what you were referring to was we got a SAMHSA grant, and we hired 5 more recovery coaches that are going out, and it is taking off fast, and there's a lot of interactions. But that is, I think the benefits of that, we won't know for some time, but certainly the personal benefits of we are picking up people, we're bringing them to treatment, we're picking up from treatment, we're bringing them to sober living, and it's creating a lot of positive community interactions, obviously, and helping a lot of people, and there's a lot more to come. It's only been in effect for essentially, we did a soft opening just with the troopers until we get everyone hired in January. So we've only been really brought all the recovery coaches on for a few months. So it's probably too soon to give you a great answer of what all the benefits are, because it's only been, like I said, a couple months. But there are, I'm really optimistic about what this will turn into and how many people we're going to be able to help. We have over 200 clients signed up already in just a couple months.
I will have to check back in a while and see what it does in terms of changing hearts and minds and reducing stigma and really changing the thinking. I see lots of heads nodding. And I had a private question for you. You're really on the front lines of implementing legislation. So it's one thing to get legislation passed, it's another to have to roll it out. And sometimes your rollout is swift. And I'm curious if you have any words of wisdom on implementation and how to really make that go smoothly, and any lessons learned.
Oh boy. I think that one thing that I think is important to know about how our implementation has gone of our various harm reduction laws is that by and large, far and wide, it's gone well. So it's kind of amazing to me how controversial our syringe exchange law was leading up until 2016 when it was passed. And I think everyone was quite shocked or a lot of people were shocked that was able to get passed. And I think everybody's always watching to see if the sky falls when a piece of public health legislation passes. I can think of any number of types of public health legislation, like smoke-free restaurants and bars law. And then the thing passes, and then people get used to it, and then and people buy into it, and it's become normalized. So I will say, there are occasional blips, and we've really had to shore up our support with our state legislature so that if there are some very isolated counties where some kind of some community members who might be more maybe philosophically opposed to syringe exchange and want to maybe go to the legislature and get changes to our law to do what we would call weaken it, put more restrictions on it. We really have to shore up that, the relationships with our state legislators and educate them about the successes and really just how well it's gone, and not let any kind of negative stories get more oxygen than the positive ones. I think that's a real danger because with the news, the negative stories are more appealing, right? And so it is always a struggle to get the positive stories out there so that is more the norm. So I think that's really my takeaway, is how well this has gone. That's the message that I would like to share, is really how well this has gone.
I wanted to comment. I think that law enforcement gets a lot of attention, and thank you, Captain, for letting us ask you so many questions. But I was impressed that you thought about district attorneys, prosecutors. I don't think they get as much attention. Has that been a group that's been receptive to your communication and education as a whole, or is that a work in progress for you? Is that a newer audience for your communication around harm reduction?
It's not a newer, oh wait, are you talking to me? Okay,
Yeah.
It's not a newer audience. We did go talk to them as soon as our syringe exchange law was passed, and now we're just kind of going back to them because it's funny when you feel like everybody's paying attention when the law gets passed, and you think, well, everybody knows about it now, and we're 7 years later, and you're realizing, well, no, they really didn't get the memo. And so we are just trying to reinforce our efforts. And I would say, district attorneys are lawyers, and they're really big on following the law. And so they're not as much about kind of questioning. I don't find our district attorneys in the business of questioning the law and like refusing to uphold it, or, they really want to know what the law is. And so I think we have more of an issue of them, you can't put everything in a statute. You cannot deal with every potential situation in a statute. There are going to be gray areas in any statute. And in fact, you want it to be a little bit gray to be able to deal with unforeseen situations, and things are going to evolve, and you don't want to have to keep going back your statute over and over again. So there are kind of gray areas in our statute. And I can tell our district attorneys struggle with that being lawyers. Like, for example, our law says that in order to get the immunity, the syringe exchange participants have to show written verification, I believe is the language. So what is written verification, right? So we don't have like a common ID. We don't have like a state issued ID. These are local programs. So one of the things we're currently struggling with is just how to, might we want to standardize our IDs, even though the statute doesn't call for that, might that be more palatable for our law enforcement and our DAs if there is some sort of like state sanctioned ID, versus when we talk to our harm reduction advocates that we have our monthly meetings with, they really push back on this idea of having a state sanctioned ID, because they say that people who use drugs might not want to be in an official state system. And so putting this state stamp of approval on it might not be the best thing for those folks. So they want more of like a grassroots program run by people who use drugs or people with lived experience. So these are the things that we struggle with. It's always interesting.
Thank you for giving us that insight to what it's like on the implementation side. I appreciate you sharing that. Dr. Park, I heard a lot of silent cheering or applause. If people could have spoken when you were making your plea for more funding overall and giving an opportunity to equally fund harm reduction. I wanted to ask you a question. I think that opioid abatement or opioid settlement money is on the minds of a lot of policymakers in different states throughout the country right now. I wondered if you had any thoughts or perspectives on how abatement money or settlement money could be used to support some of your thoughts on harm reduction or drug checking or surveillance or research.
Yeah, thank you. I have been actively involved in the Rhode Island opioid abatement settlement funding conversation. So I can tell you what Rhode Island has been doing, and maybe that can be helpful for other states that are listening in. Well, when we talk to drug checking programs, the number one issue that we hear is funding. So funding for staff, funding for equipment, and these are, so drug checking programs typically are not standalone programs. They rely on existing infrastructure such as syringe exchange programs, community-based organizations, even the Overdose Prevention Center on Point in New York, they host a drug checking program. So it is, it's about not just focusing on the drug checking program itself, which is, an important thing to try to set up and fund in your state, but also the organizations that interface with the people you are trying to reach. And so I would think about all the various ways, the touch points for patients with OUD, and really focus on, those. But and just to go back a little bit to what I mentioned earlier about drug checking not being a silver bullet, neither is cracking down on xylazine, other policies, standalone policies. What else can reduce overdose? Because, with the opioid abatement funding, the goal is to really tackle overdose. So drug treatment programs, providing access to methadone, buprenorphine, and other evidence-based programs, really important. Supporting naloxone, which Anna mentioned earlier. There are also other kind of newer technologies that are available. If folks are interested, I'd be happy to answer any questions about overdose detection technologies. And of course, changing policies also takes funding. And I believe Rhode Island is going to allocate some funding to really examine and see where there are policy gaps and things that need to be addressed of that nature.
Thank you. Melissa, that was all the questions and comments that I had on my notes. So I'm going to hand it back to you.
Great, thanks, Tara. I had a question, Dr. Park, for you. I believe you had mentioned in your pre-discussion marginalized populations, and I'm wondering how you feel like implementing the model law in states can help positively impact those communities that are hard to serve, underserved. Perhaps they're not comfortable with coming to services. And we talk about that sometimes in the context of syringe service programs. Really, they are such a great hub for so many services, but it's hard sometimes to get people there. So how do you think that this model law will help support those communities?
Yeah, I think this model law will really help because it doesn't just focus on making fentanyl test strips legal to distribute, but also, all of the paraphernalia and equipment that is required to support such a service. I can't stress how negative people's interactions have been with carceral systems in this country. And so the fear, the stigma, the issues around confidentiality, these are huge barriers for people struggling with opioid use disorder. And so whatever we can do to minimize those risks, harm reduction doesn't have to be just about people who use drugs. We can also think about harm reduction as a framework for developing strategies. And certainly it reduces the harms associated with, in this case, law enforcement interactions by adopting these types of laws. I also didn't, I'm not sure if this is the right time to mention this, but one very simple way that that states could consider revamping their, current paraphernalia laws is to just remove them. That's actually, it could be a simple approach. And I know Alaska, and there are a couple of states considering this or, have bills underway. And the reason being that, drug paraphernalia laws really are what they're called the Swiss Army knife of law enforcement. And just the idea that someone could, if I was running a drug checking program and someone could be arrested just for having a Ziploc bag, like, to me, that just doesn't make sense. It's not a good use of taxpayer dollars. It just, practically speaking, doesn't do a whole lot. And we also really need to think about what is it that incarceration is doing for that person's life when they're released. Many people that I talk to have a history of incarceration, have been in and out of jail many, many times. And oftentimes it really doesn't stop them from using. And in fact, it increases their risk of an overdose. So there is this intersectionality between what we are doing on the public safety end and on the health of our communities. So these are the types of things we should be thinking about.
Thank you. Anyone else have thoughts on that?
Were you asking about the opioid settlement money?
Oh, Tara had earlier.
Oh, Tara had. I'm sorry. Well, I did want to comment on what North Carolina is doing with regard to the opioid settlement money and harm reduction. So our North Carolina Association of County Commissioners has really because in North Carolina, 80% of our dollars are going to our counties, only 20% is going to the state. So our Association of County Commissioners has really been amazing. And first of all, like hiring a staff of people to help give technical assistance to the counties when they're figuring out how to spend the money. And this staff is very well versed in harm reduction, has worked in harm reduction, and they've done a series of webinars on harm reduction topics. And we've just had a conference in June with many harm reduction sessions. So there's a big emphasis on harm reduction strategies and in spending the money in North Carolina. And then also, I know that I was just involved in a meeting yesterday of our state health department and we are saying we need to come up with a list of strategies to recommend to our state legislators and how to spend that 20%. And we will certainly be looking at harm reduction strategies and recommending to them how to spend that money.
Mhm. That is great. Thank you, Anna. One last question before we start closing out. When locals, communities and states are thinking about or moving towards a model law on drug checking, any thoughts on recommendations for data? What types of data should they be preparing to collect in order to propose it? Or any data sources or points of interest that they can use from other states that have been successful in telling the story through data?
I have a number of resources that I could share. If there are certain research papers that could be useful. I believe there are a number of reports that have been written by various agencies as well that I could dig up. Definitely don't feel like you have to reinvent the wheel. There are many resources out there, and over 16 programs have already been set up across the US. So I think that, we could lean on each other to share those resources.
Yeah, that's great. Thank you, Dr. Park. So in our last few minutes together, we would like to give each of the panelists a minute or so to provide any advice to state and local leaders who are working on these issues, whether it be harm reduction, overdose prevention, or their model law. Captain, would you like to go first?
Sure, I'll go first, and I'll say that we're real lucky in New Jersey, and I'll take the credit away from us or anyone else here. And where I'm going is that the way New Jersey is situated, our Attorney General, he enacts whatever he sees fit, and all law enforcement in New Jersey has to follow suit. So with that, I mentioned in the chat, we had the Overdose Prevention Act, Attorney General John Hoffman at the time, who I know has a personal story behind and personally affected behind substance use disorder. So he was able to put and really set the tone early on in 2013 here, 10 years ago now, how law enforcement was going to respond to overdoses and how, immunity from prosecution at the scene of overdoses, if you called, and things like that. So what I'm getting at is that it was really strong leadership on the public safety side, and really set the tone early on. And I think that's really important from someone who has the ability to enact those measures and enforce them. And it really, I still talk to him from time to time, and what he did in 2013 impacts us so greatly today. So essentially what happened was all law enforcement was mandated to also report overdoses to my unit. And so we collect about 5,000 a year overdoses. And then we have established a DUA with our Department of Health. So now we get about 15,000 a year. And we used partnered with Washington, Baltimore HIDA with ODMAP, and we have complete surveillance of the state in kind of near real time. And we're responding to overdoses. and we're responding to spike alerts, and we're identifying bad batches, and we're really stopping people from dying. And again, our overdose numbers for the last 2 years now are trending down. And I know that's not happening as a whole in the country. I know the country's been trending up over 100,000 the last couple of years. So again, I just think it's really important to have that strong leadership and set that tone, from the top early, and that's paid incredible dividends to us here in New Jersey.
Absolutely. Yes, thank you. Anna, any closing thoughts?
Well, the closing thought would be that if you have a drug checking statute on the books and it is only limited to fentanyl, I think this is really good timing to go try to get that broadened. I think a lot of these laws were passed before xylazine was really a thing, certainly a thing that we knew about. And so we were just really fortunate that in 2019, when we passed our law, we came very close to limiting it to fentanyl only, and we were able to broaden it out. So I would think that's one thing. Another thing is that when we passed our law, there really wasn't this kind of centralized drug checking happening, this like more institutional drug checking. It was more thinking that it would be the strips in the field that users would use themselves. But this more institutionalized drug checking that's happening, for example, at UNC, it would be good to make sure that the statute did encompass that sort of drug checking. And I will say our statute didn't contemplate that. I do think that even though our statute, if you read it closely, it wasn't contemplating that type of checking. It's being interpreted as allowing that sort of checking. I've not heard any rumblings of anyone in our state saying that that is illegal. So that's kind of an interesting phenomenon too. Like it's not that your law might, once you get it on the books, be interpreted in a broader way. But anyway, I would just say, make sure that your statute does include that sort of institutional or community checking with a machine. Make sure it includes that. I mean, obviously, if you can get rid of your paraphernalia altogether, as Dr. Park said, I think that solves a lot of problems, because that would also solve your syringe exchange problems. If there's no paraphernalia law on the books, you don't need immunity for possessing syringes. So even if you could just decriminalize syringes or injection supplies, just some way to start chipping away at that would be a benefit for public health. So those are just my thoughts on where people can go next in terms of changing their laws.
Thank you, Anna. Dr. Park?
Yeah, I agree with what the captain and Anna have said. You just have to start somewhere. And I would say if you are in a state where this is like the beginning of the conversation, start with your local harm reduction organization who can connect you to people who are directly impacted by the issue. Just listen to, the types of issues that they're facing, and try to design the law so that it minimizes any, confidentiality issues and, carceral sort of experiences. And feel free to reach out to, I'm happy to be a resource. There are a number of researchers and organizations doing this work nationally. So please feel free to reach out and use these resources, because they are available to you.
Yes, thank you so much, Dr. Park. There have been a lot of resources that have been placed in the chat today, so I hope that they'll be helpful for everyone. So Anna, Captain Piotrowski, Dr. Park, thank you so much for your expertise. And I feel like we've learned so much today, and just hearing your knowledge and your experience and your passion for this is just really, really enlightening. And I hope that our attendees were able to take a lot from that, and it'll help support them in their conversations in their local communities and state. So Tara, I'm going to turn it over to you.
I want to join in that thank you. And also, Melissa, I want to thank you for being our fearless moderator. This recording will be made available on the Knowledge Lab tab on LAPA's website, along with some additional resources in the coming days. John has been kind enough throughout this webinar to be typing in lots of resources. And John, I want to give you a moment to actually come on camera and share anything that you'd like to share live with our attendees before we wrap up. John?
Thank you, Tara. And first, I want to express my gratitude to all of our panelists for this engaging and interesting discussion. A couple points about the LAPA resources. One, my own personal comment about model laws. If you're looking at one for the first time or not for the first time, you don't sort of have to view it as an all or nothing proposition. They're also very useful for providing examples or ideas, for instance, of ways in your state, if you're interested in broadening, going from exempting fentanyl test strips to something broader, or, our law talks a little bit about syringe service programs, but doesn't really do it comprehensively. You may not, or it may be, politically impossible to get an entire model law pushed through, but there you can use it as ideas for ways to expand and things to think about. Regarding our 50 state, we call them 50 state summaries about sort of where states are on particular issues at a particular point in time. We have one on syringe service programs. We have one on drug paraphernalia more generally, which actually looks at, as it was originally written, our, testing is drug checking equipment part of drug paraphernalia, our syringes and needles part of drug paraphernalia, and what the exemptions are. Those 50 state summaries, which have been linked, and you can find them under the research tab at LAPA, we try to update them. The syringe service program right now is dated June. Both that are up there now are 2022. Syringe service program 1 is being updated. I have seen the update, so that's getting fairly close to being posted through June or July 2023 information, and it's on my to-do list. But the sort of where everybody sits with testing equipment is also being updated. There's been lots of change in the last year, and so it's taking a bit to sort of get everybody's where things are being added and subtracted. And then lastly, we have fact sheets about particular topics. The xylazine one's been listed. We did one on syringe service programs, which are more sort of easier to digest information. The 50 state summaries are a pretty heavy read. It's more for seeing where your state compares to everybody else. And with that, I will send it back to Tara.
Terrific. Thank you, John, for popping on. If LAPA is a newer organization to your state and you are not familiar with all of the resources and ways that they can help you, they've done a brief 15-minute overview of what LAPA is and how they can assist you at no cost to your state. That video will be available on the Knowledge Lab, and we will send out a link to that recording when we send out the recording of this webinar to you. So I encourage you to check that out. We also encourage you to sign up for the LAPA newsletter and updates. You can do that on the LAPA website at the bottom of the page where it reads join our mailing list. I want to thank you, ONDCP, again, for funding and otherwise supporting this event. This was the first of a few future knowledge labs, and I want to just preview what we have coming up. We are also going to have future knowledge labs on overdose prevention, treatment in correctional settings, school-based overdose prevention, substance use during pregnancy, treatment in emergency department settings, and overdose fatality review. The Overdose Fatality Review Knowledge Lab is scheduled for August 17th, and I'm going to post a link in the chat to register, but we'll also be sending out links to register to our attendees at this webinar. And with that, thank you. Have a great day, and I appreciate your attendance today.